Hi, my name is Levitt Brown. I am a student here at William Woods University studying sports law. I am here to present to you a parent meeting video covering risk involved in participating in athletics and activities. The benefits of high school sports are innumerable, but they come with an unavoidable drawback: injuries. The reality of athletic competition is bodies break down and injuries happen. Despite this reality, efforts are always being made to minimize the risk of injury for the 7.7 million participants in high school sports. While that task might involve many individuals within the high school setting, perhaps no one plays a more significant role than the coaches, the athletic administrators, and the parents. 77% of parents express concern over children's sports injury risk. More than 5.5 million children and adolescents receive medical treatment for sports injuries every year. Every 25 seconds, a young athlete suffers a sports injury severe enough to go to the emergency room. High school athletes account for an estimated 500,000 doctor visits and 30,000 hospitalizations each year. Youth sports related injuries have increased 500% to 700% in the last 10 years. One of the things that we suggest and require for parents is pre-participation physical evaluations. In order to participate in our school's athletic program, every student athlete must receive an annual pre-participation evaluation, which will determine his or her readiness to participate in athletics, and may uncover any underlying conditions that could limit participation and or increase the risk for injury or a medical emergency. Parents can help by talking to their doctors and ask them to perform full participation evaluations that are required for high school athletics. What the athletic administration does to decrease risk involving participation in athletics and activities. What we do, while we cannot solve every problem that arises, we attempt to hire the right coaches and athletic training personnel that can help us prevent and treat injuries. We educate athletes and coaches on the best practice in reducing medical emergencies and injuries. We provide professional development opportunities covering risk involved in participation in athletics. And we provide to our programs qualified athletic trainers. Some of the common risks involving participating in athletics and activities are: one, dehydration and heat-related illness. One of the most common risks involved participating in athletics is heat-related emergencies. In fact, our coaches are required to participate in a heat acclimation course conducted by the National Federations of High Schools. We encourage our student athletes to drink water before, during, and after practice in order to prevent dehydration and the risk of more serious heat-related illness, such as heat exhaustion and heat stroke. Athletes should start practice, play fully hydrated, and drink water every 20 minutes during practice. One of the things that we are very concerned about: overuse injuries. We attribute this to children specializing in one sport. And this is some of the reason why we're seeing more overuse injuries time and time. We educate our parents about the risk of overuse, because the parents are the ones that are going to make the decisions about their student athletes' participation here at our school and away from our school. We also encourage our players to warm up, as we believe that it prevents sport-related injuries, and it is essential. Some of the overuse injuries are sprains, and these are mostly ankles, muscle strains, bone or growth plate injuries, as the children are still growing during this period in their life. Overuse injuries are difficult to diagnose and treat often because students will hide this from coaches and parents. So we ask parents to talk to their children, because the consequences could end up being major injuries. One of the big ones that we discuss and that people nowadays are very concerned with is concussions. One of the main risks of participating in athletics is the possibility that your child could sustain a concussion. A concussion is a type of traumatic brain injury that occurs when a head impact jars or shakes the brain inside the skull. Approximately 90% of diagnosed concussions do not involve a loss of consciousness, so it is important to look for signs and symptoms of concussions. Concussion symptoms can range from mild to severe and can last for days, weeks, or longer. If your child has received a head impact, it is important to look for signs of a concussion. Here are some of the signs and symptoms. Some of the physical symptoms of concussions are dizziness, problems with balance, nausea and vomiting, balance problems, sensitivity to noise, sensitivity to light, blurred vision, headache, low energy level, unequal pupils, and seeing flashing lights. Some of the mental symptoms of concussion can be difficulty remembering, confusion, inability to concentrate, inability to think clearly, mental fogginess, inability to remember new information, trouble paying attention, and loss of focus. Some of the sleep symptoms of concussions are sleeping more than usual, unable to fall asleep, sleeping less than usual. Some of the emotional symptoms of concussion are easily angered or upset, feeling nervous, anxious, feelings of sadness, crying more than usual, lack of interest or unusual activities, and depression. You can get a detailed list of these signs and symptoms by going to our website. In conclusion, although there is no way to eliminate all injuries from athletic competition, we take an active role in design and implementation of the appropriate professional development for coaches. We believe two of the most important components to injury prevention is, one, have coaches that properly teach safe practices and create a culture of respect and safety. And two, we believe that many injuries could be prevented if students took care of themselves nutritionally when they are not participating in athletics. Talk to your children about the importance of making you and coaches aware when these elements may have occurred. I'd like to thank you for listening, and I hope this video presentation on the risk involved in participation in athletics is helpful. Thank you, and have a good day.